Hello and welcome to ICSA Labs continuing webinar series on the 2014 edition Standards and Certification Criteria for Meaningful Use Stage 2. My name is Kevin Brown and I'm the ICSA Labs Healthcare Security Manager. ICSA Labs, as you may know, is an ONC ACB in the Permanent Certification Program, meaning authorized by the Office of the National Coordinator as a certification body for EHR technology. ICSA Labs currently performs testing and certification of EHR technology to the 2011 standards and criteria supporting meaningful use stage 1, as well as providing custom testing services and testing and certification of other IT security software and products. Testing to the 2014 edition criteria is anticipated to begin in January of 2013. If you have any questions about ICSA Labs or any of our other programs, please feel free to email us directly or at ehr@icsalabs.com. Today we have our Healthcare Program Manager, Amit Trivedi, presenting an overview of the 2014 edition certification criteria related to standards and interoperability supporting meaningful use stage 2. Keep in mind the discussion we will have today is related to draft test procedures published by ONC. There may be changes in the test procedures when the final versions are published, but we feel it is important to keep up to date and monitor the progress of these types of requirements in order to plan strategically for the future, and that is why we are conducting this third session in a series of webinars for health IT stakeholders. We've designed this webinar to be interactive. We will have some poll questions for the audience throughout the presentation, and we will also reserve time for Q&A at the conclusion of today's presentation. Please feel free to submit any questions you may have through the live meeting interface. The slides from today's webinar are available for download via the handouts button near the top right of the screen. It looks like 3 pages of paper. We will also be posting a recording of the webinar on YouTube later this week. With that, I'd like to thank you all for your time today, and we will move on to the main presentation. Amit, the floor is yours.
Thank you, Kevin, and thank you, everyone, for taking some time to join us this afternoon as we go over some of the interoperability-related criteria for the 2014 edition program. Some of you have been on some of our past webinars. We've been holding a series of webinars throughout the proposed rulemaking, now the final rule, and as the test procedures are nearing their finalization. And so we hope this will be a helpful program for you guys. We've designed this slide deck to be a resource for you. At the end of the slide, or at the end of the presentation, I'll be going over some of the test tools and implementation guides, and I think some of those are helpful links to have in one place. So with that, I just wanted to give you a quick overview of our agenda today. I'll be starting with a brief introduction about ICSA Labs for those of you who don't know as much about us. I'll also be very briefly going over some of the changes and updates in the 2014 edition program. We have had a series of webinars that have covered the changes in the program, new and revised criteria, but for those of you who haven't attended those, a brief overview might be helpful. After that, I'll get into the interoperability-related criteria for the 2014 edition, and I'll try to provide an overview of each criterion, along with some other information, including whether there's a test tool available, whether there's implementation guidance, and any other details we might have about the test procedures. Some of the test procedures haven't come out yet. ONC has released 4 waves of test procedures to date, and so there are a couple of test procedures, and usually they're the more complicated ones that are still remaining to be published, but we're anticipating having another webinar on some of the remaining interoperability, transport, and security criteria, a part 2 of the security criteria in November. And then finally, this presentation ends with some slides that speak to some of the additional resources. They're the test tools that have been made available. Most of them are all in beta format right now, and so it would be helpful to take a look at the test tools, and I know the developers would also love to have feedback and commentary from folks as well. And I've also included some links to some of the specific implementation guides. One of the things you'll see in this the 2014 criteria is that there are more implementation guides and there are more test tools, and that's one of the big differences from stage 1. And so with that, just a brief introduction on ICSA Labs. We're an independent entity within Verizon. We've been in business for over 20 years, running extensive programs on information security certification. And while our main core competency has been in IT security products, testing and certification, we've been administering the ONC EHR certification program as part of the temporary program and now what is the permanent program. So we have been recently designated as an ONC authorized certification body, and we are also, our test lab was accredited under the NIST National Voluntary Lab accreditation program. And so a little bit about both of those accreditations. One of the requirements for the permanent certification program was that testing and certification activities be performed by distinct and separate entities. And so ICSA Labs Test Lab was independently accredited by NAVLAP, and then ICSA Labs certification body, which is a different set of people, were also accredited by ANSI. And then overall, ICSA Labs was given authorization by ONC to administer the program. And so part of this accreditation involved reviewing our quality management system, our policies and procedures, testing our staff on competency, and we went through all of those accreditations, and there's a number of requirements that are ongoing for us to maintain compliance with both of those programs. So ICSA Labs both tests and certifies health IT products for the ONC Certified EHR Technology Program. And the main thing, as most of you I'm sure already know, the use of certified EHR technology is a requirement for providers and hospitals to receive their EHR incentive payments and as they demonstrate meaningful use. And that's probably why we're all here today. So with that, I'm going to speak a little bit about the 2014 edition program and just give you a brief overview of some of the updates and changes. And for those of you who are following along, I'm going to be on slide 8. But before that, we're going to jump in and do a quick poll and ask a couple questions of you folks just so we can get some additional info and tailor this presentation to your needs.
Okay, our first poll question today is, what is your experience with EHR certification and testing? So your choices are none, this is all new, stage 1 complete, stage 1 modular, other certifications, or not applicable. If you've done both stage 1 and other certifications, go ahead and select stage 1. Okay, looks like most of the voting is done here. And as you can see, it looks like about 10% of the attendees haven't done any testing, and about 63% have complete certifications, and another 26% have modular.
So, you know, one of the things about this program is we're in stage 1. We were in stage 1. Now we're looking at stage 2, and the idea behind this was raising the bar and an incremental progress throughout each of these stages. And so, for those of you who have some familiarity with stage 1 and 2011 testing, stage 2 will be a little bit easier.
And our second poll question today is, what type of certification are you planning to pursue? Maybe you're still gathering information, you're still looking to certify against stage 1, or maybe you're looking for one of the 2014 editions, either complete ACHR or modular, or maybe you're not looking to pursue any certification at this time and are just attending for educational purposes.
And through the course of this presentation, we'll also be explaining a little bit more about the base EHR and some of the options you have. So to be clear, the only certifications that are offered are complete or modular in the ambulatory or inpatient domain. However, there's a subset of criteria that if you certify against, that qualifies you as a base EHR, and we'll be talking about that in just a bit.
So it looks like about half, a little over half, are pursuing the complete, and over a quarter are going to be going for the modular, and just 5% are going for base, and a few are still looking at stage 1 or still gathering information. All right, thank you for your time on the poll questions, and I'll turn this back over to Amit.
Okay, so as I mentioned, we're in stage 2, and so for those of you who are familiar with stage 1, the main goal for that was capturing the data in coded format, and so most of the testing and the criteria is related to interoperability dealt with generating documents and messages in conformant formats. And now with 2014 edition, stage 2, the goal is to expand exchange of clinical information in structured formats. And so for the first time, we'll be doing some testing around the transport and actual exchange of clinical documentation and messages. So that's one of the big changes going forward in the 2014 program. So there are a number of other changes and new concepts that have been introduced in the final rule. And very quickly, one thing is a set of new terminologies. So you'll be hearing us speak less about the permanent certification program and more about the ONC Health IT certification program. Previously, things were divided into the temporary program, permanent program. The temporary program sunset on October 4th, and so now we're all in the permanent program. There's a revised definition of certified EHR technology, which I'll get into in just a little bit. And then the stage 1 and stage 2 designations for meaningful use. When we talk about the criteria for certification, we'll be referring to that as 2011 edition or 2014 edition, respectively. So when we talk about criteria, it'll be 2011, 2014. When we talk about meaningful use, it'll be stage 1 and stage 2, and hopefully that'll help clarify things going forward. The final rule also introduced additional flexibility for folks who are pursuing certification. One concept is adaptations, which Michelle had covered in a previous webinar. So if you haven't checked out those webinars, they are available on our site. There's links to it in this presentation, and you can go back and listen to those recordings. But adaptations, so if you certify a product and then make it available on a tablet or mobile app, that certification may be able to be extended. There's a new concept of the minimum standard code sets. So for certain code sets like LOINC coding, if there's a new version that comes out after the regulations have been passed, they've provided a quicker and easier pathway to get new minimum standards approved, so folks aren't locked into older versions of code sets. The security requirements have been moved to what they call a base EHR. As I mentioned previously, there's a subset of criteria that are defined as the base EHR, and those are the ones that are required to have privacy and security certification testing. Previously, for stage 1, any module that was certified also was required to do privacy and security testing. And so now security functionality will be governed by the base EHR. And so modules, if you're pursuing a modular certification, it's your you have an option of whether you want to pursue those privacy or security criteria. Of course, we always recommend that you do. We think that they are reasonable criteria and that most modules should meet them, but the idea here is not to, stifle innovation or impose requirements on modules or programs or applications that they may not make sense for. And then finally, there's gap testing. So for criteria that are unchanged from 2011 edition, there's the possibility of not having to test for those previously tested criteria if they're unchanged in the 2014 edition. There is also greater transparency, and I'm on slide 11 if you're following along. And this is, the greater transparency is towards purchasers and consumers of these certified products, and the transparency relates to how the products are listed on the chapel and the certification body's websites. So the first major new difference is that test reports and results are going to be made public. And so basically, the test results that the certification body uses to render their certification decision will be posted on the certification body's website, and there'll be a link from the chapel, the Certified Health IT product list that ONC posts their certified products on. There'll be a link back to the certifying body with additional information about the test results. Pricing. There's another requirement for vendors and folks who have certified products to disclose additional types of costs, not dollar amounts, but types of costs that providers might need to pay to implement the EHR meaningful use capabilities. So this refers to subscriptions or any ongoing monthly, weekly, yearly type costs in addition to purchasing the software. And then finally, depending on the criteria being tested, the self-attestation that you supply may include information about your quality management system and user-centered design approach. And that really only is applicable to a couple of the criteria, but the main takeaway here is if you're a vendor and you're testing, going forward, you're going to want to pay more attention to the self-attestation that you provide, as that may become public, and what you decide to test on and what you don't test on, the results of your certification will also be public. And then finally, as I mentioned before, 2014 in Stage 2, it's about raising the bar. And so there's 3 criteria that relate to interoperability or clinical document exchange that really do raise the bar going forward. And those relate to secure messaging, transmitting information to a third party, the whole view, download, transmit. And then there's also data portability, the batch CCDA exports. The 2014 edition certification criteria are organized a little bit differently than the 2011 criteria. For 2011, criteria were distinguished by numbers like 170.304 and .306 to tell the difference between ambulatory and inpatient domain criteria. For 2014, they've reorganized how they've categorized the various criteria. And they're now organized by core category: clinical, care coordination, clinical quality measures, privacy and security, patient engagement, public health, and utilization. So instead of going by domain, both ambulatory and inpatient will be under 170.314, and the letters will now designate what category the criteria come out of. This is a slide that ONC has used to kind of illustrate how the relationship between a base EHR and the various other certification criteria relate to each other. The main thing, and now I'm on slide 15, is that there's been a revised definition of certified EHR technology. So now, for 2014 edition and the permanent program, the minimum certified technology needed to qualify for incentives is what they're calling a base EHR. So that covers demographics, patient history, problem lists, clinical decision support, CPOE, quality measures, exchanging information, and some privacy and security criteria. There are additional EHR functions required based on the meaningful use core and menu set objectives that the provider or hospital seeks to achieve, as well as the specific clinical quality measures that the provider decides to report on. And so a base EHR isn't a certification designation in terms of a complete or modular EHR, but it's more of a collection of EHR modules, or a complete EHR would also encompass the requirements for a base EHR. And so slide 16 is actually out of the final rule, and revised, it is actually the definition of certified EHR technology. And slide 17 is another recap of the 2014 edition certification criteria that would be required to satisfy base EHR. And so I've kind of sped through these slides, but as I mentioned, we had covered these previously on another webinar, and that's up on our site if you need to go back and review that. Slide 18 speaks to the common meaningful use data set, and this is related to the interoperability requirements because they're applicable. The meaningful use common data set is applicable to 5 criteria, and they're mostly all related to the patient summary criteria, so the CCDA. And so that's the view, download, and transmit, the clinical summary for ambulatory, the transitions of care for receive, display, and incorporate, and then create and transmit, and the data portability. And so this common meaningful use data set includes things like patient name, sex, date of birth, race, ethnicity, which are both defined by OMB, preferred language, smoking status, problems, et cetera, et cetera. So each of the patient summaries that you generate will use this common meaningful use data set. And finally, as this 2014 edition overview is about to come to an end, I just wanted to remind folks that the temporary program sunset on October 4th, so we're operating under the permanent certification program. So 2011 edition testing still is going on, and that will continue until the beginning of fiscal year 2014. And for folks who do want to test under 2011 edition, the testing will be similar. I think the differences are on the certification end in terms of things like that I mentioned around transparency, around test results and pricing and things like that. So basically anyone who gets certified going forward is going under the permanent program will be held to the rules of the permanent program. And then finally, 2014 edition Stage 2 testing is anticipated to begin in January 2013. We're in October right now. We have 4 of the test procedure waves released in draft mode. We're expecting the final versions to be released by mid-December, and that should put us in line for a January start date. And with that, Kevin, I wasn't sure if we had a time for another poll now.
Yeah. So for our next poll question will be, what are your impressions of the 2014 edition criteria to date? Too difficult, too easy, just right, or too early to tell yet? All right. It looks like 75% of you think it's still too early to tell, and the rest of you are split evenly between too difficult and just right. So hopefully as more test procedures are released and we're able to continue these webinars, we'll be able to get that number down in the too early to tell yet category. All right. And then our final poll question today is, how would you gauge your level of readiness as far as testing your product to the 2014 edition criteria by the program launch date? So if you expect your product to be among the first certified, maybe you're ready by early February, spring of 2013, summer of 2013, or maybe you're not sure, or you know it's going to be a while yet.
So judging from the poll results, it looks like if I'm going to take any vacation, February is the time. But otherwise, it looks like there's a split across with many folks. Some folks are ready to be among the first certified, and there's some folks that are still a ways off. And that makes sense. You know, Stage 2 is about raising the bar. There's quite a few of new standards, new implementation guides. So I would imagine it will be a reach for some folks. But being prepared and staying informed as the process unfolds is definitely helpful. And so hopefully we can keep you on that track to do that.
All right. And with that, we will return to the presentation.
Okay. And now I'm going to go through the various interoperability-related criteria. And with this first slide, and this is slide 21, I just want to give you a quick overview of how I've laid these out. Basically, you'll see the criterion itself, and if possible, I'll try to copy and paste the actual criterion. There are some test procedures, as I mentioned, where the test procedure hasn't been drafted yet. The test procedure notes section includes some helpful notes and tips from either the preamble of the test procedure or just you know, other things to keep in mind about the particular test procedure, whether we'll have comments in there as to whether data is vendor supplied or if there was a standard referenced, maybe some clarifications about the particular test procedure. And then on the far right, you'll see a box with the summary information. And this is for each of the subsequent criteria. I've tried to put the criterion in its proper category. Market status is either new or revised. I've also labeled the difficulty, and this is a little subjective, but it's between green, yellow, red for easy, medium, and hard, and that's kind of based on what kind of tools are available, the implementation guidance, and just basically it's subjective, but it's my opinion as to how difficult the test may be or how difficult it may be to implement the particular technology. So if you're doing a quick scan, you could probably look through that and maybe pick out the low-hanging fruit. I've also included whether the criterion was part of what they would consider a base EHR, whether the criterion was related to meaningful use core or menu objectives, whether there's a reference standard, implementation guidance, a test tool, and whether the particular criterion referenced the common meaningful use data set. And at the end of this presentation, there are a couple of slides that list all the various implementation guides and links to the various test tools. So hopefully that will be helpful. And so with that, let's start with that first criterion, and this is 170.314A imaging. And so this is part of the clinical category. And the criterion is electronically indicate to a user that the availability of a patient's images and narrative interpretations related to the radiographic and other diagnostic tests and enable electronic access to such things, such images and narrative interpretations. So in the test procedure, they mentioned that the definition of image and narrative interpretation is outside the scope of the test procedure. And as a testing body, those are things we don't usually like to see outside the scope and defining words. We like to have these things defined as best possible to prevent any kind of confusion. But what this means is earlier on, in the proposed rule, the DICOM standard was referenced, but it was subsequently removed in the final rule. Folks had asked whether photography, ECGs, what images were allowed. And basically, cardiology, pathology, radiology, photography, ECGs, MRIs, all the images are permissible. It's not required for the technology to store the images. You need to be able to demonstrate the ability to directly link to the images stored in the system or provide a context-sensitive link to an external app that provides access to both the images and the associated narrative. And finally, immediate electronic access is also mentioned in the criterion, and that was intended to mean that the user should be able to electronically access images and their interpretations without having to log into a separate electronic system or repository. And so this particular criterion doesn't have a reference standard. As I said before, they did reference DICOM, but they removed that. So there isn't any specific implementation guides to look at, and there isn't a test tool. So this will be pretty much an observation-based test step. But the main thing to keep in mind is not only the patient images, but they also want you to demonstrate the ability to view any narrative interpretations that go along with it. The next slide, slide 22, is the patient-specific education resources. This is also in the clinical category. This is revised from 2011. There was a similar criterion in 2011. This is not part of the base EHR, but it's part of the core meaningful use requirements. And it references some HL7 standards. And so there is implementation guidance, there isn't a test tool, and the meaningful use, the common data set doesn't apply. So basically for this procedure, you need to demonstrate the ability to identify patient-specific education materials using the HL7 context-aware knowledge retrieval standard and implementation guide, as well as through another means. So basically two different ways. One of the ways is through the HL7 info button, and the other is up to you and at your choice. And so every HR technology must be able to identify the education materials for all of the categories, for the problem list, med list, and lab tests and results. You can use either the URL-based implementation guide or the SOA-based implementation guide, and I have links to both at the end of this presentation. And many folks met 2011 certification requirements by connecting with or using Medline Plus, and so that's still a viable option. And the folks who authored this particular test procedure wanted to note that Medline Plus Connect also supports the info button standard. And so this procedure is for 2 or more patients, and the data is vendor supplied. The next criteria, slide 23, is transitions of care, receive, display, and incorporate. So the CCDA is one of the big new standards. It's required in a number of different criteria. I've rated it as a difficult criterion for a number of reasons. The criterion talks about receiving, display, and incorporating. The receive and display isn't too bad. At least the display part, most folks have attempted in some form or fashion if they've done 2011 certification. And if you recall, you had the option of doing, actually there was no option. You had to view both the CCD, C32 document, and the CCR. It's anticipated that for this test procedure, there will also be a step to make sure that the technology can still view the C32 and the CCR. And then the CCDA will also be the main part of this. And the one thing to keep in mind is they've included incorporate now. Previously, the 2011 criteria spoke to basically just bringing in a document intact. Now, the term incorporate, the folks who drafted this procedure, they clarified that that means that the EHR technology needs to be able to process structured data contained in the 3 consolidated CDA sections, medications, problems, medication allergies, such that it can be combined in structured form with data already maintained by the EHR technology. And this will also come into play into another criterion, which I'll talk about in just a moment. But basically, the technology must be able to extract and allow for individual display of each additional section or sections that were included in the transition of care summary document. So it's definitely a significant raising the bar. We're not just asking you to bring in a document and look at it by applying the style sheet. There's actually some discrete data import and section import that's involved. Now, there is a test tool. There is implementation guidance. There's the reference standard, and the common meaningful use data set does apply. Though all that being said, I've still rated it as hard since, actual incorporation of data into structured elements into the EHR, that's a pretty big step forward. And for folks who had implemented the CCR, the CCDA will probably be a significant step forward. For those of you who are looking into the CCDA and have implemented the CCD, C32, the C in the CCDA is consolidated. What's going on there is basically they've consolidated the various different templates that were put into play by, So the C32 referenced all kinds of different templates, and for folks who are implementing that particular document, you would have to look at the C32, the C80, the C83, and then other IHE documents. And the idea here is one document that has all of the CDA templates in there to provide a more easier implementable solution there. And so the slide 24, transition of care, the second part of that particular criterion is the create and transmit. And so for this, again, test procedure has not been published, and it's similar to the previous one. The EHR technology must enable a user to electronically transmit a transition of care or referral summary in accordance with the applicability statement for secure health transport specification. And basically, this also involves using the transport testing and the transport testing tool. And we're actually going to spend much more time on this particular criteria and a couple other ones in a future webinar. The reason being, one, the test procedure hasn't been published, so it'd be best to speak directly to what is in the test procedure and tease out any issues that may lie within. And two, there's a test tool, and it's in beta, but we're still working with that, and some of the newer functionalities are still being added to that. But what I'd like to do is be able to provide a demo that actually goes through using some of these tools. But here is a screenshot of the transport testing tool, and this is one of the newer things as far as 2014 testing. You'll see as we go through these the slide deck that there are quite a number of new tools, which from a testing standpoint is great because we don't want manual or visual inspection. We want automated test tools whenever possible. But if you see this particular test tool, you'll see that there you can do straight up message validation. You can also include validation through using some kind of a transport. There are a number of options, and this particular test tool would be used for the transition of care, the summary for ambulatory, the inpatient summary, and a number of other documents. But I'll be talking about each and every one of the test tools and provide links for those so folks can kick the tires, as it will. So I'm on slide 26 now, and this is 170.314b3 e-prescribing. And so for folks who had completed this in 2011, it should be similar. I've rated it a difficulty of yellow, medium. I think for folks who have done this before, it shouldn't be as difficult. For those who haven't done it, there's probably some work to do. And for most of the people who had done certification in previously, they had partnered with an e-prescribing partner. So if that's something you are looking to do, that's something that might take some time and you may want to look into ahead of time, figuring out who the various partners are and who you want to work with. But that's often been a common pathway. And so one of the big changes here is the reference standard. In 2011 edition, we were allowed to use either NCPDP script 8.1 or 10.6. Now it's been upgraded to just 10.6. There is an implementation guide. However, it is available only to members of NCPDP. There's a link at the end of the slide deck. And there is a test tool that will be available this time, which I think that was one of the bigger sticking points of 2011 testing. There wasn't a conformance test tool. There were some differences in what were the meaningful use requirements versus the implementation guide requirements. And so there are a number of stumbling blocks there. But on slide 27, there's a screenshot of the e-prescribing tool in its beta version, and it should be available for folks to test both XML and EDI or EDIFACT messages of the NCPDP script 10.6. And again, as I've mentioned, there will be links to these tools for you guys to check out on your own. The next slide is slide 28, and this is 170.314b4, Clinical Information Reconciliation. I mentioned earlier bringing in the CCDA in structured format, and this is the criterion that's somewhat linked to that. So if for folks who had done 2011 testing, I'm sure you may remember the clinical information or medication reconciliation test procedure. And to say it was underwhelming was probably pretty accurate. It was basically bring up two lists for the end user to compare. Well, now we're actually moving into electronic reconciliation of data. And so we're looking at the active medication problem and medication allergy list. And so the requirement is for each list type, you need to be able to electronically and simultaneously display the data from at least two list sources and allow the user to view the data, their attributes, at a minimum the source and last modification date, then enable the user to create a single reconciled list of meds, medication, allergies, and problems. They can be single individual lists. It doesn't have to be one list with medications, allergies, and problems on there, but you want to reconcile the two different lists, so two medication lists, two medication allergy lists, two problem lists. And you're supposed to enable the user to review and validate the accuracy of the final set of data and update the list. And so it was intended that the meds, the allergies, and problems are able to be incorporated from a consolidated CDA document that you've imported. And so there are statements, and we're going to be looking for further clarification just to be certain from ONC, but there are statements that refer to a preference to using the CCDA. However, However, there's a statement that in the event that data is in unstructured form, any method implemented by the EHR that's capable of assisting reconciliation is acceptable. So that may be a potential out, but what we do want to confirm is if you are testing against the consolidated CDA and incorporating that patient summary, that is how you may be expected to demonstrate the clinical information reconciliation. I've also rated this one as a hard because this involves importing structured data and actual reconciliation, and so it's a fairly large step up from the previous certification requirements. I'm on slide 29 now. Incorporate lab test results and values and results. This is a revised criterion. I've rated it as medium difficulty, and the main reason being, most people are familiar with HL7, and folks usually don't have an issue passing those particular test requirements. The main thing is having specifications to look at and having clear guidance. For folks who had done 2011 testing, one of the areas that was difficult was syndromic surveillance with the completely open-ended test procedure. One of the most successful and smoothest test procedures was immunizations because they had a great test tool, specific test messages that were required, and a pretty solid implementation guide. And so you'll see that they've tightened up a lot of these things. And so for this particular test procedure, unfortunately the test procedure hasn't been published yet, but we do know that they'll be referencing the S&I Framework Lab Results Interface, which is a pretty new specification. So that's the one thing that's to keep in mind. I think if there are any comments or around that particular decision was, folks commented that it's pretty new, it's still in development and hasn't been in production, but at the same time, this is a newer version that folks have worked very hard to create and try to take care of a lot of the ambiguities and issues that have popped up in other specs. And so this particular spec, the LRI specification, references both HL7251 and 271. But, and that's why if you look at how it's referenced in the standards, they may not say HL7, they may just say LRI specification. But there will be a test tool again, and it'll be similar in that you'll be asked to incorporate the test results, and you'll be asked to display those same clear requirements that were required in 2011. And the other main thing for 2011 was when you had to incorporate test results. In fact, they didn't even say HL7. It was any means you used, any electronic means necessary. So now they have a specific version, specific implementation guide. And so here's a link to the LRI validation tool. I definitely suggest taking a look at that as well as the implementation guide. And another note, so for just about all of these test tools, I would recommend using Firefox or Chrome. And if you need to, Internet Explorer. But I found Firefox and Chrome work the best for almost all of them, though I know folks are working hard to make sure that they're compatible with at least all three of those. This is another screenshot of the LRI validation tool. For those of you who are familiar with previous test tools, you'll see the handiwork of NIST. One thing to keep in mind about these, and I'm on slide 31, is each of the test tools that NIST has developed usually has a tab called documentation on that yellow bar, and that actually is chock full of helpful information from everything from test sample messages to PowerPoint presentations on how the validator works to additional clarifications about the specification. So that's always a good place to take a look if you run into any questions. I'm on slide 32 now, and so transmission of electronic lab tests and values to ambulatory providers. This is another yellow medium difficulty because this actually involves transmitting the lab results to a provider. And again, we'll be using a test tool, and there is implementation guidance, but the test procedure hasn't been published yet. And I'm going to speed up a little bit as I notice we're not running short on time, but I still have a number of slides to go through. So the next slide is on data portability. And again, we rated this one as hard. It's a new particular criteria, and it involves being able to export a set of patient summaries for all of the patients in an EHR technology. The way the test procedure is going to work is they're going to ask you to enter one specific patient chart for the test data set, and then when you export all of the CCDAs or all of the patients in your technology, we'll be looking for you to at least export a minimum of, I think, 5 or 6. It'll be 5 plus the one patient that you're asked to enter the information ahead of time. And so, again, this will make use of the NIST transport testing tool. The CCDA validation is implemented through the Open Health Tools website, so that's also worth taking a look at. And yeah, so implementation guidance available, test tool available, and reference standards. It's difficult in that it's a newer criterion, but if you can generate one summary, hopefully that's the difficult part. But then after that, it's you know, creating the functionality to do batch exports. And again, here's another screenshot of that transport testing tool. I'm on slide 35, and so there are 3 different measures, or a couple different test procedures around clinical quality measures, and these are also ones that we're going to go into in more detail once the test procedure is released. So here you have the capture and export, and so there's a new reference standard, and there's a test tool, but it's in development, and we've rated this one as hard again, just because new spec, no test tool yet, and quality measures has traditionally been kind of a tough test procedure for a number of reasons, both from developing standpoint and from a testing standpoint. One thing I'd recommend is taking a look at projectpophealth.org. It's an open source tool that was developed by the MITRE Corporation in conjunction with ONC, and it's set up to help healthcare providers perform meaningful use quality measure reporting and helping you export compliant quality measures and helping testing bodies validate the results of these particular test procedures. So projectpophealth.org, take a look if you get a chance. The second part of the clinical quality measures, slide 36, is the import and calculate. And again, we've rated that as hard just because now we're being asked to incorporate data from other EHR technology and correctly calculate the results for the quality measures. I'm going to, and then the third is electronic submission. So there were 3 parts. So there was the capture, the export, and now electronic submission. And so this particular test procedure tests the capability of the technology to create the standard data file that can be accepted by CMS. And so there's the HL7 QRDA, and that's a newer spec. And so we've also rated you know, all of the clinical quality measures as the difficult category. View, download, and transmit to third party, 170.314E1. This is similar to previous ones. Again, this will involve actually transmitting a document, so making use of the direct protocol and transport testing. The test procedure hasn't been published yet. It's probably among that last wave, which will have some of the more complicated test procedures. But when, as I mentioned, we'll be doing another webinar to cover some of these last remaining test procedures in the near future. But it's a new criterion. This also makes use of the common meaningful use data set, but there are test tools available and implementation guidance available. Similar to that, the clinical summaries. This is for ambulatory only, and it's basically enabling a user to create a clinical summary for a patient in human readable format and format it to the CCDA. And slide 40 also gives you a screenshot of that testing tool. So the next couple test procedures are related to HL7, and this next one is 170.314F2, which is transmission of immunization information. F1 is actually capturing the immunization information, and that is one that they've marked as unchanged. This one is revised since it's actually there's actually some significant changes to this particular test procedure. So one of the main things is the minimum standard code sets apply with CVX. The certification criteria does not address transports. but you know, the CDC and American Immunization Registry Association has recommended soap-based transport for the immunization data. The other thing to keep in mind is previously you were asked to generate one message for immunization. It was just the vaccine update. Going forward, you're going to be asked to generate 7 different test case messages for each procedure. And so if you review the test procedure, you'll see a number of different cases instead of just a single one. And it makes it a more robust test procedure and actually encompasses more use cases and real-life workflow. Slide 42 is actually a screenshot of the new and updated immunization validation tool. And as I mentioned previously, those are one of the more straightforward test procedures that we found went well for both us as testers and folks who were actually implementing and self-testing. Just it was a good test tool and it worked well for folks. And I think they'll be leveraging that kind of work in some of these other test procedures. So 170.314F, transmission to public health agencies, this is another one. This is the syndromic surveillance criterion. And so this is kind of a big issue in 2011 in that they had some issues with the actual implementation guide that was mentioned in the final rule, and it was the wrong one, and subsequently they removed it. And the final criteria was any HL7 231 or 251 message, which is in terms of interoperability, not particularly helpful. But going forward, with the syndromic surveillance, they have gotten much more specific. They've referenced HL7V251, and they've referenced a specific implementation guide, the FIN messaging guide for syndromic surveillance. The interesting thing is for ambulatory, the requirement for inpatients, the requirement is clear. It's HL7251 and the FIN messaging guide. For ambulatory, it's HL7251 or the HL7 FIN messaging guide. So that gives you a little bit of wiggle room and optionality. But the main thing to know is that they are looking for specific message profiles. This wasn't mentioned previously in 2011, so it's pretty open-ended. But at least for 2014, you know that they're looking for ADT A01, A03, A04, A08 messages, and the test data sets are should give you a good idea of what they're looking for. There were no test data sets in 2011, so that contributed to its open-endedness. 170.314F4, transmission of reportable lab tests and values. This is for inpatient only. It should be very similar to the previous criterion, though it is marked as revised. I've rated it as easy as I think anyone who has certified against this previously, it shouldn't be a big step up to meet this criteria for 2014. There will be a reference standard, there will be implementation guidance, there will be a test tool, though the test procedure is not yet published. I would anticipate, as with immunizations and syndromic surveillance, they'll be asking you to generate multiple messages, not just one test message this time. Slide 45, transmission to cancer registries. That's 170.314F6. So this is an optional criterion, so it'll be interesting to see how many folks actually pursue this for certification. It's new. We've rated it as difficult just because it is pretty new. The implementation guide for this is based on the CCDA, and they're working on it to harmonize it with the consolidated CCDA. But there are 6 different test cases that need to be generated for this, so 6 different documents that will be validated. And there's a special validation tool for this. And for those of you who are familiar with 2011, this should look familiar in that there was the meaningful use validator for C32. Well, now this is the meaningful use validator for cancer registry. And it's similar to the C32 validator in that there's one button. You choose the file and then you validate it. And so it should be fairly straightforward, but it's pretty new. And with that, that actually gets to the end of the main presentation. So I'm going to very, very briefly just point out what we have included here in the resources. So very quickly, if you get a chance, I would highly suggest signing up on our e-newsletter so you can stay up to date. We try not to send you too much info, but just enough to keep you apprised of the latest goings-on, whether it's new draft test procedures, public comments, or pilot testing. So the other thing is that we have our past info sessions and the webinars also uploaded up at ICSA Labs, and our previous presentations covered the new revised and updated criteria as well as the privacy and security criteria. And then we have some upcoming webinars as well. So we have November 6th, we'll be speaking about pilot testing, and December 12th, we'll be doing a webinar to kick off the new program launch. In between there, and we'll be shooting out information via our e-newsletter and other reminders, we'll be holding a webinar to cover some of these transport-related and interoperability-related criteria that we don't have the test procedures for yet. And we're looking at tentatively at November 21st for that one. And so the test procedures can be found at this website on the ONC's healthit.gov. Waves 1 through 4 have already been published and have gone through public comments. We're currently waiting for Wave 5, and there'll be a 2-week public comment after that as well. Mid-December, we'll be hopefully looking at the final versions of the test procedures, and sometime between then and the launch of the program, we will actually be doing some pilot testing activity. And so if anyone's interested in that, especially any of you folks who said you're ready to be among the first products certified, please contact us if you're interested in doing any kind of pilot testing. That can be mutually beneficial. Us as we iron out our testing process, and for you to get a kind of a preview of the testing methodology. And finally, today we went over the NIST test procedures. All the information is publicly available, and you can reference and look it up yourselves. But for folks who do sign on with us, we do provide all of our applicants with customized test scripts and pretty comprehensive guidance documents that delve into some of this information and more in terms of tips and stumbling blocks and things to look out for. Slide 50 is the test tool catalog. I think this is a good slide to have handy, so you can take a look at all the various test tools that have been developed. And, they've come a long way since 2011. So we have test tools for testing the cancer registry document, which is a CCDA document, the immunization registries, public health syndromic surveillance. We'll have the other public health tool out soon, reportable labs, lab results interface, e-prescribing, and the transport testing tools. So quite a slew of different tools that ONC has developed in support of this program going forward. The one you don't see on there is around quality measure reporting, and we'll see what comes out with that. But I did mention Pop Health, so that's something you guys can look into in the meantime. And slide 51 and the next couple slides are all links to implementation guidance. So some of these are links to HL7's website where you can download the standard. They've made certain IP free, whereas previously you had to pay for or become a member and purchase any of that. There are other links to the CDC for public health reporting where they have some free implementation guides available. There's links to the SNI framework website, NCPDP, the National Quality Forum, HL7 again for the info button, and some additional items around the transport, which, as I mentioned, we'll be speaking about more in a future webinar. But if you haven't, it's probably a good idea to review the SNI framework and the IHE's documents around XDM and XDR, as those are also potential avenues. Finally, these are on slide 54 some additional resources beyond just implementation guides that folks might find helpful. So there's CDC has set up a whole page on meaningful use, and so you can look up the various things from immunizations to public health reporting to get more information on that. HL7 has a page on standards that are referenced in the final rules, so you can quickly get to one page and download and get to the various standards that have been referenced. I've included a link to the SNI framework. There's the National Library of Medicine. They have, it's free, but a license and registration is required, but you can get all kinds of information on code sets, RX norm, LOINC, etc. There's a link to e-prescribing 101 from NCPDP. As I mentioned, that particular standard is under lock and key, and you have to be a member to buy it, but many folks wind up satisfying that requirement by partnering with another EHR or EHR technology. And then finally, quality measure reporting, check out projectpophealth.org. And finally, I've left a couple links to the actual test procedures and the meaningful use final rules from healthit.gov. And we'll be following up shortly with a presentation on security, transport, and associated test tools for interoperability, probably in mid to late November. And with that, I think we ended just a little bit over. There are a couple questions that came in, and we'll try to follow up with you folks offline. If there are any questions that you have and didn't have a chance to get addressed, please feel free to email at us or give us a call at any of these using our contact information. Also, I'd like to remind you, if you get a chance, please try and go ahead and download this presentation, as I think there's some helpful additional resources there. And so with that, thank you all for attending, and we look forward to speaking to you next time. Thank you.
And that will conclude our presentation for today.